everyone. I'm Tristan.
I'm Adonis.
I'm Sunny.
I'm Tyra.
So our topic is about COVID, and the topic question is, how does COVID affect the reservation? Okay, but the definitions are how, adverb, in what manner, way, or what way or manner, by what means. COVID, noun, an acute disease in humans caused by coronavirus, which is characterized mainly by fever and cough and is capable of progressing to severe symptoms and in some cases death, especially in older people and those underlying health conditions. It is originally identified in China in 2019 and became a pandemic in 2020. Effect, transitive verb, to produce, and effective, on something or someone. And then reservation, noun, an area of land held and governed by federal recognized Native American tribal nation.
Okay. So for my summary, I picked an article about how COVID kills Native Americans at much higher rates than other groups. So COVID-19 killed Native Americans at a rate of 2.8 times higher than that among white people. Last year, before vaccines became widely available, the mortality rate for disease among the group was also considerably higher than that of Black and the Latino population. Native Americans living in rural reservations face greater risks of dying from COVID-19, likely because of poor living conditions and inadequate access to health care. Overall, Native Americans are more likely to face socioeconomic and health-related risks. Factors for COVID-19. Native Americans and Alaska Natives have long been disproportionately affected by poverty, food insecurity, and poor health outcomes from several diseases such as heart and kidney disease. Native Americans living in rural reservations faced greater risks of dying from COVID-19, likely because of poor living conditions and inadequate access to health care. Native Americans are more likely to face, some tribes still live in reservations too, and many of which are in remote areas, far from healthcare services such as COVID tests and treatments. Many Native Americans also don't have access to healthcare insurance other than IHS, which is a chronically underfunded health system. I wasn't able to finish my summary, so I'm just going to look. I've only had like 2 more sentences.
Okay, and then I'll go next. My summary was also on like tribal things that we lack on reservations regarding COVID. So indigenous people in the U.S. were about 3.5 more likely to contract COVID-19 than white Americans, especially with the younger age during a study done on 23 states during January until July 3rd in 2020. There wasn't a national response to the COVID-19 outbreak. Instead, it was left to the states. Sovereign nations and other tribes had to create their own restrictions. Living conditions among these indigenous people in the United States are non-congressional settings are more crowded than the general population. The average household and family sizes with indigenous in the U.S. were shown to be way more overcrowded than the white American in the U.S., resulting in less space to social distance if one in the household is contracted with COVID-19. Once COVID hit at its hardest, Studies show that tribal people who lived on reservations had less access to public health information regarding COVID-19. On these reservations, some families don't have access to telephone/mobile and internet connections. These are just some of the examples into why Native and Alaskan Americans were affected by COVID-19. Most. These resources we lacked played a big role in getting information to us. Along with that, our food storage also lacked less than other Americans living in the U.S. Our local reservation grocery stores had less workers and supplies being brought to our stores.
Thank you.
So my summary was basically about Native American health. So there have been millions of cases of COVID in the United States. Native Americans were hit extremely hard by the virus. We are much more likely to contract the virus because according to Fordham, we have one of the worst health statistics in the United States. A lot of Native Americans have bad diets which lead to having health problems such as diabetes, obesity, mental health issues about oneself, and more insecurities. This is an ongoing cycle that tends to be consistent through different generations. Another reason why Native Americans have bad health is because addiction is a major problem on reservations. Inheriting drugs at a young age is becoming an issue for Native American minors because the availability of drugs on the reservation is very accessible. And then once someone tests positive with COVID, trying to find medical attention can be very difficult, especially on reservations, because typically there's only one IHS on a reservation, which is a very big problem. Knowing that you have to keep your distance due to COVID. And with hospitals getting filled with many people seeking medical attention, others have to wait for an opening. And who knows how long that wait will be. And that's all I have.
My article was on the impact of COVID-19 on American and Alaskan Natives. It says, the American and Indian and Alaskan Native healthcare systems have had many instances of historical failure in which Native people have been unable to get the help they need. The current pandemic is yet another example of this. Nonetheless, it is a good opportunity for change. Epidemics were first introduced to the Native American communities with the first arrival of Europeans, causing the start of intergenerational trauma. Many people either experienced the pandemic firsthand or know someone who has. COVID has just magnified that fact. This has caused more trauma in these communities. Native people already have a mortality rate that is 50% higher than other populations, and COVID has become yet another factor. COVID has not only influenced the mortality rate, but it also has taken a toll on social, economic, and traditional practices within the community. Many tribes rely on the revenue brought in by casinos and tourism to fund healthcare, as well as many other systems such as education, housing, and even law enforcement. So having went into lockdown due to the pandemic, this has caused them to forcibly lose that income and has created a negative long-term effect on these communities.
All right. Solution-wise, we had general outlook of Native American health, the access to Indian Health Service or lack of. Each one of you kind of brought some information that talked about potential solutions because the problems are multi-layered. And criteria-wise, measuring, I think, what database, Tristan, did you use? It's in the link. Was it Gale, ProQuest, EBSCO?
EBSCO.
You didn't use, how about you, Tyra?
I used EBSCO.
EBSCO? Sunny?
I also use EBSCO.
So you all were EBSCO people. Because sometimes there'll be variance with where the data comes from. It's not a problem that you all did it. But as researchers down the road, you might want to jump out into just more than one. EBSCO was good for you. It worked. And then Q&A from the audience about COVID-19 for the group. Any surprises in your studies? Was there something that you didn't know? Because to me in research, there's always a surprise, like, I didn't know that.
In my article, it stated that the Navajo Nation, I didn't write it in my summary, with the Navajo Nation, they didn't have like adequate amounts of water, which really affected their population. They did lose a lot of elders, just a lot of people in general. I didn't know that.
Yeah, they were on the nightly news because they were hit really hard at the top of the pandemic. So, awesome.